Thank you, Deputy Speaker. I am very pleased to speak about an issue that I've learnt more and more about in the last 10 years or so, and I want to thank the co-conveners of the Parliamentary Friends of Diabetes for bringing this motion to the Parliament. Diabetes is a complex disorder, and we all know that if it isn't diagnosed early and treated effectively, it can lead to very serious health complications such as blindness, limb amputation, heart disease and stroke, and kidney disease. And as someone who's spent a number of years working within the Department of Health and other agencies up in the Northern Territory, I've seen firsthand some of the consequences for Aboriginal communities in the Territory of a failure to treat these sorts of conditions. And it certainly tells us there's a lot more we can be doing. I think most of us here would agree that there's a need for a national diabetes program working with the states, and always more research and more support. An estimated 2 million Australians with pre-diabetes are at risk of developing type 2 diabetes in the next 5 to 10 years. I know, as the daughter of someone with diabetes, that I certainly carry higher risk factors. I note the government's announcements this year about subsidising flash glucose monitoring to on the National Diabetes Services scheme. I do think it was a shame that that came a year after it was actually promised. There had to be a massive community campaign by Australians with type 1 diabetes and by the opposition, and it included the tabling of a petition with 214,000 signatures in Parliament. The Minister had promised, as of the 1st of March 2019, that continuous glucose monitoring would be expanded and that the flash glucose monitoring would be included in that expansion. And I just think we shouldn't be asking these groups of people who struggle in a day-to-day way to do the things they have to do to live a normal life, also have to be such fierce advocates in order to get very sensible changes to the health system to improve their quality of life. Because of the delay, thousands of Australians were forced to continue a painful regime of finger prick testing for a year because of that broken promise. And why these flash monitors make such a difference was recently demonstrated by comments from a doctor who's the chief of the Division of Endocrinology, Diabetes and Nutrition at a hospital in Paris, Bichon Hospital, and I apologise for my pronunciation, who says the use of flash glucose monitoring, which is with a sensor rather than strips, is associated with a drop of the incidence of a majority potentially lethal acute complications of diabetes in insulin-treated people. And he said the magnitude of the protection potentially afforded by the device is huge. And that's the sort of thing that we do need to hear from places that have been using this for quite a lot longer than we have. I've had a lot to do with children in my electorate with juvenile diabetes. From their Kids in the House Day, where we here get inundated with children who have type 1 diabetes, to make sure that we understand the impact that it has on their lives and how we can help them with additional funding for research, through to events in my own local electorate. And last year I was very proud to lead off the JDRF One Walk in both the Blue Mountains and the Hawkesbury. JDRF says it's the biggest type 1 fundraising event in the world, with walks right round the globe bringing together around 1 million people. I joined JDRF advocate families at the start of the walks, and each of those walks in the different parts of my electorate raised thousands for research into juvenile diabetes. What's inspiring about these events is the determination of the children and their families to overcome this chronic life-threatening disease. They can explain to you really patiently about pinpricks for blood glucose testing and the difference continual glucose monitoring makes and how that changes their lives. What's also inspiring is to see the adults who were diagnosed as children, who are going along to these events to be role models and mentors to their younger selves. I'm very pleased to see the announcement that a large population study will take place in Australia, funded by JDRF Australia. They describe it as a huge step forward for research, and it's a first in Australia, one of only 3 in the world, to screen people from the general population without a family history of type 1 diabetes. Labor, of course, has a strong track record in supporting juvenile diabetes research, funding the establishment of the JDRF Clinical Research Network in 2010. We had planned to provide additional funding if we'd won the last election, and that funding would have allowed the Clinical Research Network to enter a new phase, increasing the volume and impact of the type 1 diabetes clinical trials.